We don't know what the future is. We could have him for 50 more years, or we could have him till tomorrow.
A diagnosis a Metro family never expected. Their 13-year-old son living with an incurable heart condition. All right, so their son was diagnosed with a genetic heart defect, and that happened at birth.
The diagnosis doesn't always come at birth. With Heart Health Month coming to a close, our Katie Kaplan sat down with a pediatric cardiologist.
Well, welcome in. Today we have pediatric cardiologist Dr. Jill Shivapur here joining us to talk about heart health. Obviously, February is set aside to really focus on that. And I'd love for you to tell us a little bit more about CHDs, congenital heart defects and disease. Let's just start with the basics. What are they?
So congenital heart defects are something that a child's born with, and most commonly nothing causes it. Sometimes we can go back after they're diagnosed with it to find maybe a gene change that can be a base etiology for it, but often it's just random. And rarely is it something that was maybe in their environment during the pregnancy, and it can happen about 1 in 100 infants that are live born.
Wow, so it could be genetic, it could be environmental, or it could be completely random.
Correct, yeah.
How common are CHDs?
So of the live-born children that we know, the medical literature says about 1 in 100 infants born will have a congenital heart defect. So about a 1% chance that anybody could have a child with a congenital heart defect.
I know it's really scary for families, and I can imagine for people that are maybe wanting to start families, what should they know about CHDs?
Great question. So most important thing is as soon as they know that they're pregnant or expecting, get that first OB visit, establish a really good set of primary care for mom. Okay. And then the OB will walk the family through all of the typical screening processes. And most commonly around 18 to 22 weeks, they'll get what they call an anatomy scan. And that's where most commonly our congenital heart defects could be found before being born. However, a lot aren't, because mom is doing a lot of the work with baby in the womb. And so it's really post-delivery, following up with your primary care provider, your pediatrician, your family medicine doctor, to make sure they listen to baby's heart, make sure baby's growing and feeding well. Those are the biggest things to watch.
And from what I understand, there's even adults who could be walking around thinking that they're healthy, but they have an undiagnosed CHD. Are there any warning signs that people should keep in mind at any age?
Warning signs would be most commonly as you age, it would be with exertion, not feeling as well as you expect. So other people around you may be doing the same occupation and you're having a lot harder time completing that same task. Sometimes it can be fast heartbeats, we call palpitations, or out of nowhere the heart just races and nobody knows why. And then that's a sign that you should stop, touch base with your primary care doctor, and then they can do the next steps of testing. And sometimes we do find congenital heart disease even much later in life, and people are surprised without a doubt.
Thank you for everything that you do to help children with congenital heart defects, and thank you for your time today.
Yeah, thank you for letting us talk about such an important thing.
Thanks, Katie. Doctors are also encouraging people to get certified training in CPR, to pay closer attention to where the nearest defibrillator may be in a building, and to take care of their own hearts.